Don't come and ask for care package and point out road and garbage to be collected. When from the pool of resources that is paid in taxes, we have to take out almost $10 million to put aside for COVID response, when we could have easily gotten over that.
Today we are handing over the genome sequencer, which I regard as a natural follow-on to the RNA machines that we handed over some time ago. This sequencer will not only test for variants of COVID-19, as I understand it, but for all other viruses, Professor, you can correct me. So it will not become obsolete in the post-COVID era. It will still play a pivotal role in healthcare in Jamaica. At the moment, the arrangement is to send samples to the Caribbean Public Health Agency in Trinidad for testing. And needless to say, that this option presents enormous logistic and other challenges to us.
Currently, Jamaica needs to significantly strengthen its surveillance capacities to rapidly identify and care for cases of COVID-19, identify variant strains of the virus, trace and quarantine contacts, and monitor disease trends over time. Comprehensive national surveillance of COVID-19 will require the adaptation and reinforcement of existing national systems where appropriate, and scale up additional surveillance capacities as needed.
In terms of funding details, Chase provided $40 million for the acquisition of this machine. Importantly though, I want to say that we did not only purchase the equipment, but we also provided financing for maintenance and servicing for 3 years, as well as for training and technical support. The machine itself also comes with a 1-year warranty on hardware and software.
It was just about the time that I had to give my budget presentation, a few weeks before, and there was a debate in Parliament, and the opposition spokesperson on health wrote a little note and said, Prime Minister, we should get one of these machines, we need to get one of these machines. And I responded to him and said, I agree with you, I'm going to try and pursue it. Now, just for the benefit of the public, what the public sees is the government and opposition or other interest groups always in conflict. And it does serve some interest for the public to always be of the opinion that we are in conflict and that there's no collaboration. It does serve some political interests. But it is not always the case. For national issues, for issues where clearly we have to rise above politics. For context and for the public's understanding, one would expect that as Prime Minister, I would say, Billy, write a check and go and pick up the machine. And I'm saying it in this way because I'm oftentimes questioned in this manner. Why do we have the genome machine yesterday? Because this is an emergency, it's a national emergency. We're in a pandemic, the machine should be here already. And we can't be convenient about it. That in sometimes we say, abandon the procurement rules, and in other times we say, see, you didn't follow the procurement rules. And within the procurement rules, obviously, there are provisions for situations like these emergency situations. But even then, there is still bureaucracy which is necessary to combat corruption and waste. COVID-19 is no longer new to us. Our citizens are aware of what they need to do to protect themselves. Government can't always be over you to tell you wear your mask, sanitize, social distance, and of course, the Minister of State went on to tell you, if you are sick with any respiratory-like symptoms, use your conscience, stay at home. Jamaicans have therefore now been armed with the means to protect themselves from the virus. And one of the important means would be vaccines. We have enough vaccines. We have a whole heap of vaccines. vaccines that will go to waste because you sit at home listening to nonsense and fool people. Get up and go to the vaccination stations and let us get over this pandemic and return to a new and better normal. Don't come and ask for care package and point out road and garbage to be collected. When from the pool of resources that is paid in taxes, we have to take out almost $10 billion to put aside for COVID response, when we could have easily gotten over that if you were to be wise citizens of your own country, acting in your interest and in the interest of your family, your community, and the nation. Social media is a phenomenon of the last decade, and of the last 20 years or so. We have seen an expansion in media. So those two phenomena, expansion of media and indeed the emergence of social media, which is an uneditorialized space, which means that the information does not go through any process of vetting or checking. And so we are exposing a population, some of whom have not attained the standard level of education needed to properly vet and verify. They're not information literate. And so the universities have the duty and the responsibility, if the society is going to get through this, not just safely, health-wise, but mentally as well, with an improved knowledge of these threats that exist. We need to see our experts out there in the forefront, combating the nonsense that is being placed in social media. We have provided the resources for the vulnerable. We have built capacity, as we're doing here now, to ensure that we can have information on the virus. We are able to respond to it strategically. And the other response, which I believe is the most critical response, which is to get the population resilient to the virus. That process is being impeded by hesitancy. And that hesitancy is being driven by false information.